Med3D creates physical breast phantoms based on human subject images for design, optimization, and evaluation of breast imaging systems with the goal of early breast cancer detection.
Especially with breast cancer, early detection is extremely important because if detected early, the prognosis is very, very good. So yes, early detection is extremely important and imaging is critical.
The American Cancer Society recommends annual mammograms for women starting at the age of 40 to ensure all women have access to quality mammography to detect cancer at its earliest and most treatable stages. Mammography Quality Standards Act became law in 1992, and the U.S. Food and Drug Administration enforces its accreditation and certification.
Mammography is a very challenging medical imaging task. It was so challenging that it's currently the only medical imaging procedure that is governed by the federal law in terms of quality assurance. It's that important. And yet, we do not have proper tests to ensure that the quality is adequate.
Quality assurance testing of mammography systems is performed using uniform breast phantoms, which are slabs of tissue-equivalent plastics with necessary test structures embedded in them. These simplistic breast phantoms are far from representing realistic breast background. As a result, they significantly underestimate the sophistication of actual cancer detection tasks. There's currently no anthropomorphic physical breast phantom available commercially.
All of our testing, as of now, is based on uniform backgrounds. We do need to come up with anthropomorphic and anatomically relevant phantoms, so when we do quality assurance, we can be certain that our measurements can be translated into clinical performance.
In addition to regular quality assurance testing, physical breast phantoms are also essential in design and development of new imaging techniques and systems, such as digital breast tomosynthesis, which provides three-dimensional information of the breast.
What tomosynthesis does is it takes tomographic slices through the breast, and that in turn will eliminate the superimposition caused by a 2D mammogram.
So we do need to have a realistic heterogeneous tissue or phantom to be able to see the advantage of tomosynthesis. That's why I think having an anatomically relevant phantom is even more important for the case of tomosynthesis than is for standard mammography.
Physical breast phantoms can be used for system characterization, patient-specific imaging technique optimization, cross-platform comparisons, image reconstruction evaluation, dosimetry, just to name a few. They can also represent the population to run virtual clinical trials, which can actually help eliminate some of the costs and irradiation concern associated with clinical trials.
It is impractical, totally impossible, to do a complete clinical trial for all the possible nuances associated for a given technology, let alone comparing different technologies. So the only way to try to really ascertain whether a particular methodology is effective is to come up with an alternative, a surrogate. If we really want to emulate the breast, we need to start from the breast.
At Duke University, we've developed an extensive library of computerized breast models directly from human subject images. Our models combine detailed human anatomy with the versatility of mathematical operations. We employ the current state-of-the-art in additive manufacturing, high-resolution multi-material 3D printing to fabricate physical breast models based on our library of computerized models. So far, we've created several successful prototypes. We have demonstrated the first physical phantoms that can generate realistic breast anatomy in 2D and 3D images.
Very, very promising what we've seen so far. Hopefully they'll be very useful for future ex vivo trials.
Our prototypes have generated huge interest in the community. They've been presented at several international technical conferences and are constantly reviewed by regulatory organizations in the US and Europe.
I think we have the first ever realistic alternative offered through this phantom to do that.
We need capital to advance our prototypes to the next level and create customizable libraries of them. We believe we have developed the expertise and recognition that is key in translating our phantoms into clinical and research application. Our team at Med3D is passionately devoted to make this happen.